Hi, it's Dr. Charles Modlin here again for another health equity brief. Today I'm going to talk about hypertension, heart disease, and stroke because they're all interrelated. Hypertension affects nearly 50% of African American adults, significantly higher than their white counterparts. Whites have an incidence of high blood pressure of about 30%. African Americans, again, 50%. American Heart Association emphasizes that this disparity is linked to factors like diet, access to health care, socioeconomic status. We've talked about that. Effective management and education about hypertension can reduce these alarming statistics. Get your blood pressure checked. Know what a normal blood pressure is. Generally, the recommendation is 120 over 80 or lower. That top number is called a systolic blood pressure. The lower number is diastolic. Know your numbers. It's very simple to get your blood pressure checked. You can go to your local drugstore, whether it's Walgreens, CVS, whatever it is. You can go walk in many situations to outpatient clinics, get your blood pressure checked. You can purchase blood pressure kits that you can check your blood pressure at home. Also, if you've been diagnosed with hypertension, high blood pressure, it's very imperative that you take your medication as recommended by your provider, by your physician, by your advanced practice provider. Very important that you take that medication because untreated hypertension can lead to heart attack, stroke, peripheral vascular disease, and other serious conditions. So speaking of heart disease, we all know that heart disease is the #1 killer in all Americans, but it's even has a greater mortality rate in blacks. The burden is disproportionately higher for blacks. The CDC states that African Americans are 30% more likely to die from heart disease than white Americans. Again, factors such as hypertension, diabetes, lifestyle choices, a lot of times the type of foods that we eat play a significant role. Living sedentary lifestyles, not getting exercise, or additional risk factors, genetic predisposition towards disease. And so we all need to understand the risk factors, and we need to take action in terms of taking our medications, but the goal should be to prevent the onset of hypertension. One more thing about heart disease and hypertension is that we do know that in African Americans respond to different classifications of certain antihypertensives or high blood pressure medicine compared to whites. And again, a lot of physicians know this. Actually, all physicians should know this. But again, take ownership of your own health. And if you're on multiple medications, if your blood pressure is not being controlled, proactively ask your physician, healthcare provider, if you should be on a different classification of medication. But we'll talk more on that later in the month for these health equity briefs. One more thing, let's talk about stroke real quick again because it's related to high blood pressure. The disparities of stroke in African Americans are a very serious concern. African Americans are twice as likely to die from a stroke compared to white Americans. There are different types of strokes. The American Heart Association highlights that high blood pressure, a major risk factor, is more prevalent in black populations, as I've mentioned. Improving access to preventative health care, education on recognizing stroke symptoms could save lives. So again, as we go on through the month, we'll talk more about stroke, hypertension, and heart disease. But this is a lot to digest. It's a very important topic, and so I'll see you tomorrow for further discussion for our health equity briefs. Thank you. You got this.